the Lager Lecture Series, named after McMaster graduate Albert Abram Lager, a great believer in the value of lifelong education. He created the Albert Abram Lager Foundation, which supports several organizations in their efforts, including the McMaster Alumni Association. The United Nations 17 Sustainable Development Goals, SDGs, are a call to action to end poverty and hunger, protect the planet, and ensure healthy lives, peace, and prosperity by the year 2030. At McMaster, we recognize our responsibility to address these goals as we work together across disciplines and faculties, locally and globally, to create a healthier, brighter world. In 2022, our online Lager Lecture Series will feature talks by McMaster researchers, projects, groups, and alumni to showcase how McMaster is helping to reach these goals.
Good evening and welcome to this Lager Lecture Online. My name is Jessica Lounsbury and I work in the Office of Alumni Engagement here at McMaster. This evening's Lager Lecture will focus on Sustainable Development Goal 11, Sustainable Cities and Communities. We are fortunate to have Dr. Jim Dunn joining us as our guest speaker this evening. Department Chair of Health, Aging and Society here at McMaster and Urban Geography, Dr. Dunn likes to bend studies around natural experiments. He studies living communities as they undergo transformations and explores how built environments affect the mental and physical health in neighborhoods and communities. Early in his career, he helped reveal how neighborhoods that naturally evolve towards greater socioeconomic and cultural diversity produce better health outcomes among those who live there. More recently, though, his focus has turned to the question of whether this kind of healthy mixed neighborhood can be engineered or at least fostered through public policy. If you have a question for Dr. Dunn this evening, please type it in using the Q&A button at the bottom of your screen. We will have some time at the end of the formal presentation to answer a few questions. So without further delay, please join me in welcoming Dr. Dunn.
Oh, thanks so much, Jessica. And thanks to everybody for being here. Today, I will start with some slides. Today, I'm going to do a little bit of a think piece for you folks to that hopefully will result in a bit of a back and forth conversation at the end, because I'm really interested to hear about people's thoughts, and going to try and look at the connections between housing policy, our aging society, and healthcare, and think about some of the issues that frankly, in my view, don't really get raised very often, and also some of the potential policy challenges that we are going to face in the, frankly, quite near future. So without any further ado, maybe I'll just dive right in, and at the end of the presentation, there'll be ample opportunity for people to ask questions and for us to get into a bit of a discussion to the extent that that our medium allows us. So thanks again for being here, and now I'm going to get going. So to give you a bit of an overview, one of the things that I'm increasingly interested in is thinking about in the future, where will older people live? And you're going to get an idea of why that's a question, but it does have to do with concepts like aging in place that you've probably heard of before. But what I'm particularly interested in is how we must adapt new infrastructure in cities and our existing infrastructure to meet the needs of an aging population, and how we can do that at scale. So in very large numbers, because we are talking about changes in very large numbers of people. And here I'm thinking about things related to housing, to transportation, to social relationships, and to the delivery of services. And really, the big challenge that we're facing in the greater Golden Horseshoe area, and this is the area that I'm thinking about from Ajax all the way around down to the Niagara Peninsula, is how we're going to accommodate an additional 700,000 people over the age of 80 in the greater Golden Horseshoe. And the age of 80 is an important age because it is the age at which people have to demonstrate their ability to drive going forward. And it's not to say that everybody that many people can't continue driving after that time. They certainly can. But it's definitely an issue going forward because it has big implications for transportation and housing. We should certainly also be thinking about how smaller communities will cope with this additional aging population. And ultimately, the kinds of things I'm interested in have to do with really thinking about how can a city become not only age-friendly, and there's a whole framework for age-friendly cities, but age-optimizing. So how can we kind of maximize the value of our cities for increasing people's independence for as long as possible? And so the way we normally think about these things is illustrated in this particular chart, which comes from the U.S., and you'll get a sense of that in a second. But basically, over the life course, we tend to see this pattern of changing functional ability over time. And then, consistent with that, we kind of imagine that there are changes in people's accommodations and their circumstances. So, living in their own home, which is, something that gets talked about quite a lot, home with assistance, retirement, community assisted living, nursing homes, et cetera. So there's different kinds of options that are kind of tied to at least somewhat to people's health and ability to function. And then there's also costs associated with that, each of those options. And basically, as we move up this continuum, we actually see more and more costs. It's more expensive forms of care that goes along with these different housing or accommodation options. And then in this last bar, we can see that is really just asking a question about who pays. And is it out of pocket with private funding? Is it provided by community services, family caregivers, et cetera? So this is the normal way of thinking about things. Now, this is a very kind of individually based approach too, because we're talking about each individual, and we're talking about just the immediate home that they're living in and the care that they would require. But I think, we also need to think more generally about the broader environments that people live in. So what are the neighborhoods that people are living in? What are the transportation options? What are the amenities and services that are available close to them? And that's what I want to begin to talk about today. And, my interest in this is really kind of aptly summarized in this particular article from the internet, which says our infrastructure fails seniors who don't drive, and that's a problem for everyone. And this is one of the key issues, I think, that we're facing. And it has implications for housing, delivery of services, and our basically, most of our social infrastructure. So talking about this, let's just talk through a few facts. One is, that I think that we saw during the COVID-19 pandemic, there were many problems in long-term care, retirement homes that were revealed as during the pandemic. And this is indicative of a larger problem about housing and aging. And as I alluded to earlier, the population over the age of 80 in the greater Golden Horseshoe, it's estimated to increase from about 350,000 roundabout now to 1.05 million by 2041. And that's an extra 700,000 people in the next 20 years. And that's a really big number. That's an extra seven. Often people will talk about percentages. What percentage is over a certain age. Percentages hide what I think are really important, which is the actual numbers, and the actual number of needing to think about how we're going to provide accommodations and community supports to 700,000 people in the greater Golden Horseshoe. An extra 700,000 people is really important, and why this is a kind of near future problem, if you like. We have this challenge, which is a gap in the purpose-built options for people's housing career between a single family home and an institution. So what I mean by that is actually illustrated in this figure. So in housing studies, we often talk about people's housing careers or their housing career ladder. And I've taken this particular figure from an older article in Australia. So this doesn't exactly represent the North American experience. But anyways, the idea is that as people early in their adulthood start out, they will move into different kinds of housing options. And, the first one is typically living with parents, and then they might become a tenant in the private sector. And in the Australian context, they imagine that people might become a public tenant. People might become a first-time buyer, and that coincides with savings and having multiple incomes, and they might become a second-time buyer, and then ultimately later in life they become an outright owner. And then the form of these different kinds of housing career options, typically starts with, here's the roommates kind of situation here. This is actually a picture from the movie Animal House, and then people, as they sort of have independent household formation, might live in an apartment building and then move to a kind of starter home, and then ultimately to a larger home. And this is the kind of presumed or or the desired, very commonly desired kind of trajectory in people's housing careers. And what we have though is that, and what happens is that, about 75% of the population in the Greater Golden Horseshoe lives in a car dependent suburban kind of environment that has homes like that. They might be detached, semi-detached, or townhouses and that sort of thing. And for the most part, we just cling on to that for the remainder of our lives. And that's what most people do. And a very small minority of people actually outlive that housing at the top of the ladder, this house at the top of the ladder, if you like. A very small minority outlive that, and they end up going to retirement homes and long-term care facilities, which are forms of housing. And then and increasingly we're seeing, that industry is starting to see a need for another kind of form of housing, which is assisted living kinds of arrangements, supported apartments. And so companies around this region are increasingly building assisted apartments and so forth, right? So that's kind of filling in the gap between the single detached dwelling that people cling on to and long-term care and retirement homes, and then working backwards, thinking about housing with assistance. So there's this gap there ultimately. And the number of people, so even though we have this situation now where a small minority outlive the single detached and home, that may be a small percentage, but that small number or small percentage will actually be a larger number, about 3 times larger within 20 years than it is currently. And that's the demand. That will be the future demand for long-term care, for retirement homes, and some sort of assisted housing, unless we do something different about the way that we build our communities. And so the upshot of this is that aging in place, right, clinging on to the detached home in the suburbs, in the car dependent kinds of areas, actually aging in place can actually mean that people are stuck in an appropriate accommodation, particularly if they had been car dependent and can no longer drive. There's another aspect to this issue in terms of people living out their lives in this kind of housing, and that's that it creates a situation where there's lots and lots of empty bedrooms. And one report by the Pembina Institute from a few years ago actually estimated that in the GTA, there are 2 million empty bedrooms. And those empty bedrooms are creating all kinds of challenges. Some suggest that it's making it more challenging for younger families to be able to afford housing because they can't, because these houses are still occupied, that they would otherwise be able to buy into. Another, has the challenges around schools. So we see in some older neighborhoods, because there's not enough turnover into those family suitable and family designed housing, because there's not enough turnover in those houses, then there aren't enough students to make schools viable. And at the same time, that's happening in the suburbs where things are, in the periphery where things are growing, where we're seeing more and more households added. New schools are being built, and they're full almost instantly. And so we've got this mismatch between where people are located and where the school resources are. And so there are a number of public policy challenges that it's creating. Ultimately, my framework is thinking about that housing is really partly about accommodation and partly about support. So it's essentially the mixing of some form of accommodation with some form of support. And this is actually a way of unifying everything from hospitals to long-term care facilities, jails, homeless shelters, et cetera. These are all housing. In other words, they're all providing accommodation and they're all providing support. So your suburban house in the suburbs, there's accommodation, obviously, but there's also support. Someone comes and picks up the garbage every week. Somebody plows the snow so that you can get in and out. You turn on the tap and clean water comes out, the sewage is taken away, all those things, and those are supports that are provided. And it's the supports that people need to be able to live independently. But in long-term care facilities, people receive accommodations and they receive a different package of supports. Frankly, in an acute care hospital, people are receiving accommodation, right? There's beds and they stay overnight, and so in that sense they're getting accommodation, but they also get supports, and the supports are acute care medical services. And in fact, there's a particular class of patients that are known as acute but non-acute. that are high needs but non-acute. And those folks, many of them actually technically live in hospitals. They literally live in hospitals in the sense they have pictures on the wall. They use the patient waiting rooms. They use the waiting rooms like they're their living rooms and so forth. And there's been some efforts in Hamilton by the healthcare institutions to find housing for them. So they're medically complex. They're called medically complex, but non-acute. So they don't need an acute care facility, but they do need some a certain kind of medical support that is best actually provided in housing. But we for the most part haven't developed that kind of option. And so what we see is that there's a need for more innovation in different forms of accommodation and support, different configurations of accommodation support, as well as an increased supply of different housing options for aging. So in other words, people are making choices from a very limited set of options that are based on outdated understandings of what aging is, and also an outdated perspective on the lifespan, right? So, our lifespans have increased. And so as a result, this is creating new challenges for the kind of housing that we have and the kind of built environments that we live in. So, this one particular statistic that is reflected in this is that we see that about 1 in 9 newly admitted long-term care residents potentially could have been cared for at home, which is a reasonably big number. So these are people who end up in long-term care that could have lived independently on their own. And interestingly, this graphic, this is from the Canadian Institute for Health Information, identifies why that might be happening. And they identify these 4 reasons here. One of the things that they don't talk about is no housing options. And this is illustrated by one of the partners that I work with, is a group called Stillbrook Affordable Retirement Residences. And they started up because they were started by a man who was a doctor at Providence Healthcare in Scarborough, Ontario. And he ran the stroke rehab clinic until a few years ago. And what he saw clinically was that people would come through, they'd had a stroke, they come through rehab, and then when it's time to discharge them from stroke rehab, they'd have a family conference. And many of the people that they dealt with had low incomes, and they were entitled, because of their low income, they're entitled to a number of home care services, and also because of their clinical condition, they were entitled to home care services. But they couldn't discharge these people to the basement apartment that had 6 stairs down. And so then they're faced with a challenge, right? Theoretically, this person can live in the community with the right supports, and the supports are there, but they don't have a unit to live in that's actually accessible to them so that they can receive those supports. And so what happens is the family conference is told, well, you have 2 options. One is you can go into a private assisted housing situation, and that's typically from the private sector costs $6,000-7,000 a month. Or you can wait for a long-term care bed. And these lower income people invariably end up waiting for a long-term care bed because $6,000-7,000 a month is just not something they can even come close to affording. And so the challenge with that is that we have these people going into long-term care unnecessarily. And in fact, long-term care is becoming a source of affordable housing because we lack that in the community more generally. And so the interesting thing is that the founder of Stillbrook, he identified the need. He said, listen, the missing piece of the puzzle in all this is actually affordable housing. And so now he's got a model that he's trying to develop and it uses a small amount of land. It's a 7-story building. It keeps the construction costs down. It has 162 units for 190 people. And the idea is that they take all of the home care supports that they would have received and aggregate them into this building so that it allows people to live more independently. And essentially one of the big efficiencies that they benefit from is that the most home care workers make about 5 visits a day. And in this model, they make 25 visits a day. So we're going to have to be more creative about the way that we use our resources. And we don't want people going into long-term care necessarily. Most people don't want that. Most people don't want that for themselves, and it's not particularly good for the system. So that's one example of how these things work. When we kind of expand beyond housing, we start thinking about urban infrastructure and aging. There's a number of issues to take into consideration as well. So we have a very highly car-dependent, low-density urban form in the Greater Golden Horseshoe. Again, I would estimate 70 to 80% of households live in this car-dependent, low-density urban form. So they really depend on automobile transportation on a day-to-day basis to meet their basic needs, and that creates enormous challenges. Of course, once we have a much larger number of people who, even if it's the same percentage of people who are over 80 who can't drive, it'll be a much larger number than it was before. And this has been made worse in the last several years as tests to prove driver fitness have been made harder. So there's now a cognitive test in addition to the vision test and the road test. And the worry that I have is that the number of adults over the age of 80 that are stuck without a driver's license in the suburbs could grow quite quickly. And this could create a significant burden of care, just giving people rides. And it's very challenging for municipal transit systems to meet that need because it would be very costly. Certainly, provide if they were to try to provide door-to-door service and so forth. And really that cost will be very high if we're trying to provide public transportation to replace those seniors' car trips. It's going to be very costly. And, this really speaks to this notion of that people's ability is partly about their functioning and partly about their environment. And that if we had an environment where people weren't so car dependent and could get around in other ways, then we might be able to actually extend the length of time that people are able to live independently at home. The flip side of that, of course, is that clinging on to the single detached dwelling in the car dependent suburbs might actually curtail the length of time that people are able to live independently. It might shorten the amount of time that they're able to live independently. And related to that, there's also this risk of social isolation, and there's very good evidence that it's actually literally deadly and significant risk for people's health. Now, the other thing is that, of course, as much as we would all like to believe that we can get around like this, and I certainly cannot, what the reality is that winter is quite a bit more like this than it is about this. And so winter introduces a whole other set of variables around this, particularly if we're dealing with suburban environments and people trying to get around on foot without the use of cars in neighborhoods that frankly were designed for car transportation. They weren't really designed for people to get around on a regular basis as pedestrians. So this signals a whole host of questions in my view. And one of them is that how can we plan our cities so that they promote greater levels of independence for older people for longer and do so at scale? So how do we build the numbers that are required? Again, I said, we're talking about 700,000 extra people in the Greater Golden Horseshoe alone over the age of 80. The people at Stillbrook, their goal is to build, I mentioned that their buildings are designed to have 162 units, and they house up to 190 people because they have some units for couples. And their goal is to build 100 buildings in 10 years. That's 19,000 people that would be housed. And that's probably just a drop in the bucket of what's required. So we're talking about a really big challenge here. And as I don't really hear many people talking about it. I hear a lot of talk about, trying to provide home care to everybody, but I think it'll be challenging to provide home care in this kind of urban environment without people living in more dense, amenity-rich kinds of environments where they can get around without the use of automobiles. And so again, should we be thinking about age optimizing cities and age optimizing housing, and what might that look like and how would we get there? To me, it's about, having housing, transportation, social opportunities and services all in a relatively small geographic area. One of the concepts that's now being used is the idea of the 15-minute neighborhood. And so, in fact, I've got a project where we're starting to think about what would a 15-minute neighborhood look like for people over the age of 80 based on the average speed of walking. And how could we make sure that that's adequately provided across the city and provides housing opportunities for people who live in those kinds of opportunities. And then there's questions about how can this be marketable, affordable, desirable, and culturally appropriate for people, because there is a certain amount of pride that goes into people staying in the home that they have lived in for most of their adult lives. And by all means, I understand completely where that comes from. I'm a housing researcher first and foremost, and one of the biggest things about our homes is that it is a source of pride. It is a place that has a lot of meaning for us. And so I certainly understand the challenges in trying to persuade people that there might be an option that they would want to consider that could be beneficial for their well-being and for their independence for longer. And at the same time, one of the challenges that we often run into when we're trying to design policies for older adults is there's an argument that says that we actually we're quite paternalistic about the way that we treat older adults around risks, and we don't give people the opportunity to make choices and to take on risks in a way that's dignified. So they often talk about the dignity of risk, and the argument being that we actually do more to protect older adults from harms than we do children. And we don't let them have the autonomy around making their decisions about taking risks. We kind of take that out of their hands, and we don't want to do that. We want to make sure that we balance that as well. And then to me, that begs questions about what would also make such a built form ready for future use once the baby boom has sort of passed through our population, because eventually, we're going to have a bulge, if you like, of a large number of older adults. And then, the subsequent generations of older adults are going to be smaller in number, just because of the nature of the population patterns that we have. So these kinds of questions have synergies with other agendas. One of them is around urban intensification and concerns about urban sprawl and boundary expansion. So, could we combine an agenda around urban intensification with an agenda that's about trying to create urban environments and housing options for older adults so that they can live in 15-minute neighborhoods? One of the others is around efficient use of infrastructure, and I've already talked about schools in that regard. Reduced fossil fuel consumption is another factor in all of this. So if we have a greater number of people who are using transit versus private automobiles, then we reduce fossil fuel consumption, which reduces air pollution. And of course, this is now quite costly. Fossil fuels and gasoline are incredibly costly right at the moment. So, I think that's also top of mind for folks. Active transportation and routine physical activity is another aspect of this, and I've done a lot of work in this area, and it's actually a lot easier to kind of incorporate physical activity into people's routine tasks than it is to get them to change their habits and engage in more leisure time physical activity. And we may see there may be some benefits in terms of smaller communities, in terms of revitalization of downtown cores. This could be a great opportunity for some communities. It may help us address affordable housing shortages, and certainly I've been working on housing for 25 years, and so the rest of the world has now finally come around to my view that we need to be concerned about affordable housing. And it may address some of our health system challenges, right? So we've got one of the big problems they talk about in the health system is alternate levels of care. And so these are people who are in the hospital who don't belong there. And usually they don't belong there because they just can't be discharged. They've got nowhere to be discharged to. And this is a big problem in the system. And it's one of the things that is part of the cause of challenges with emergency room waits and a number of other problems in the health system. So essentially what I'm suggesting is that at the center of this is a kind of rethinking about the role of housing and the way that we understand housing and aging. So we're at 7:30. Well, I'll talk a little bit about, a colleague of mine, Michelle Wyndham West from OCAD-U, and I have a new research project that's funded by a Catalyst grant from the McMaster Institute for Research on Aging. And the first part of the research is going to begin to try to understand what the scope of this problem is in the Greater Golden Horseshoe. So we'll be looking at some fine-grained patterns of urban growth at the small area level, urban form characteristics, and care utilization in the Greater Golden Horseshoe, and then trying to identify the housing forms and urban forms that reduce risk for premature entry into long-term care. But we're also interested in what are the current housing and support pathway experiences, in particular of low to moderate income older adults, because they have fewer options, is because they lack the personal wealth and income to be able to exercise those options. And definitely interested in thinking about this from a gender and intersectional point of view, because the kinds of things that kinds of needs that people have and the kinds of desires that people have in the for their futures are going to depend on gender and ethnicity and race and so forth. And one of the examples of this is that for women, there are particularly challenging needs, because 1 in 3 older women living alone actually live in poverty and are in core housing needs. So we're definitely concerned about that as well. And what we hope to do is co-design have some co-design sessions. So that's essentially engaging in an imaginary exercise with some older adults to determine what are their current needs that are being met and not met, and what are their future aspirations for housing and supports, including transit and local amenities. And we use a method that Michelle brings to the project called Journey Maps, which is an arts-based approach, and it provides space for future making, for people to begin to think about alternate futures. And then that can lead to systems design solutions, and then scaling of those design solutions, and beginning to think about how they might be implemented. And as I say, we employ an equity analysis throughout. So that's the extent of my remarks formally for tonight. And I've left plenty of time for lots of discussion and questions. And I'm not even really conscious of how many people are out there, because that's the nature of this. That's the nature of this particular medium. So I hope there's somebody out there that's been listening to this for the last half hour, and I'm very much looking forward to anything that anybody's got to ask and wants to discuss. So thank you.
That's wonderful. Some great information for all of us to digest and think about. So thank you, Dr. Dunn. Just a reminder to our viewers, if you do have a question, please type it in using the Q&A button at the bottom of your screen. So first question we'll start off with is densification a public health issue?
Yeah, it certainly is. So it's interesting. There's the former medical officer of health from the city of Montreal, who has been retired for quite a number of years now. And frankly, I can visualize his face, but I can't remember his name. At any rate, he was of the opinion that a huge number of the public health issues that we face are actually to do with the automobile. So the automobile has driven it causes pollution. It causes it's a source of physical inactivity. It's caused us to design our cities the way they are, which is really about prioritizing automobile travel, usually at the expense of bicycle and pedestrian and other forms of transportation. So there's no question that's the case. And one of them is also around densification. So the greater, the more density that we have in our communities, the more practical it is for people to engage in more active forms of transportation. And from a population standpoint, we know from experience, it's very hard to get people who are relatively inactive to suddenly become, super active in their leisure time activity. But if we can get people to replace car trips with active transportation trips, and an active transportation trip might actually mean just walking to the bus stop, that can actually have a huge benefit from a population basis. So if we can get, a large portion of the population to improve their physical activity by 5%, that actually has a very big public health impact. And it might have a bigger public health impact than a very small number of people becoming, going from being couch potatoes to marathon swimmers, right? And so the couch potato to marathon swimmer almost never happens. And whereas the people who increase their physical activity by 5%, you can imagine that happening to quite a lot of people with the right kind of built environment to support them.
Yes, exactly. One of our viewers is asking, what exactly is the 15-minute neighborhood? If you can give us a little explanation, that'd be great.
Yeah, that's a great question. So the 15-minute neighborhood is the idea that all services and amenities that you might need on a day-to-day basis would be located within a 15-minute travel time by either walking or cycling. And so now, that might vary by different age groups and abilities and so forth. So, but a 15-minute neighbor is essentially that. So what we're trying to do in part of our project is we're trying to identify what's the kind of core set of services and amenities that older adults might require, and on a day-to-day basis, things that they're using less frequently, people can travel longer distances for, but things that you're using on a day-to-day basis. And then how can we map out the areas of the city that have that particular bundle of amenities within a 15-minute travel time by cycling or walking. And to the extent that there are kind of deserts, if you like, of where there aren't areas where there aren't 15-minute neighborhoods and there aren't those set of services, we can use that as a planning tool to say, okay, well, we need to, build up the resources that are in this area versus this area.
That's great. Thank you. Someone is saying, my wife and I, age 82 and 91, realize we can sell our car and still save money locally by using taxis. Is this a useful option for many? Yeah,
I think it often is. People usually underestimate the cost of using a car. And the fact is, there's also a built-in incentive for people to use it once they have the cars. So because you pay for insurance for the entire year, it's like, well, I might as well I better use it. I mean, I'm paying for it anyways. But people really do underestimate it. And it's interesting because I just spent a couple of months in Vancouver, and in Vancouver, they have a car share system that's really well developed. It's called Evo. And so the cars are all Toyota Priuses, and it's all done with an app. So you go on the app and you look, and it can locate where you are, and it can tell you where's there an Evo nearby that's available. You just press on that car and you say, and it reserves it for 30 minutes. You walk to the location of the car, you press on a button on the app, and it opens up the car and off you go. And it charges you. So the really interesting thing from a cost perspective is it charges you 45 cents a minute. Now that sounds expensive, except that includes everything: gas, the price of the car, the gas, the maintenance, the insurance, and the parking, actually, because the Evo, usually you can do stopovers, but of course you're still paying 45 cents a minute. So there's a disincentive to do stopovers. But the thing is, when you get where you're going, you just park it wherever you like. So if it's at a metered spot, or it can even be in certain kinds of no parking areas, you can actually leave the Evo. And it's there for somebody else to use. And so I see Spencer, who took a class with me a few years ago, is saying Communato is doing that in Hamilton quite well. Yes, absolutely. The scale of it, right, in terms of the density and the number of cars and the amount of use in Vancouver is just staggering. So I'd say that's the one difference. So there's no question that there's a way to figure it out, and there's a really well-worn path that's been led out by Vancouver.
Yeah, that's great and very interesting. How do immigration numbers fit into softening the boomer bump?
Well, I'm not sure exactly what that's driving at. I mean, the usual way that aging and immigration are connected is thinking about, we have to have a labor force that is earning wages and paying taxes to be able to support the services for our older populations who are no longer in the labor force. And to that extent, there's a very close relationship. From a kind of housing and urban form perspective, it's probably not quite as tight, but I think the underlying commonality is that we do need to think about housing supply, that we're creating enough housing supply to meet the needs of everybody. But that probably we do need more innovation, is what I'm suggesting, on what kinds of forms of housing are most appropriate, and then trying to, particularly as people age, and trying to give people incentives to be able to move into those forms that are going to allow them to be able to age independently for longer.
Great, thank you. What, if any, role or can the not-for-profit sector play, and how would this sector be integrated to help in solving these issues?
Yeah, well, the not-for-profit sector is really important in this. And so one of the things that has been a big focus of the National Housing Strategy in Canada, has been building up the what we call the non-market sector. So we can't count on the market sector to do all of the things that it needs to do in terms of affordable housing and below market housing, so forth, because it just doesn't pencil out for them, and they have a profit built in and so forth. And Canada actually has a relatively small, compared to other countries, non-market sector. So there's a lot of effort right now in building more capacity for development in the non-market area. Hamilton is actually home to a number of organizations that are particularly good in this respect. But again, the challenge is always scale. Like, how do we scale these things, and how do we do them quickly? Because it's a really, running a development corporation, be it non-market or market, is a really complex thing, and planning approvals and construction and those sorts of things have a high degree of complexity. So one of the things that we're doing, an initiative that I'm leading, which is called the Canadian Housing Evidence Collaborative, is we're trying to build capacity in housing research, because we've been really we've really lacked that in Canada compared to other countries. The UK has 6 or 7 university-based housing research centers, and Scandinavia has a few. And in Canada, we have very little of that kind of capacity. So we're trying to fast grow a succession of cohorts of emerging scholars who we hope will be able to contribute to better policy solutions. And at the same time, there's organizations that are trying to help people build organizations that can allow them to be non-market developers of affordable and targeted housing for different groups, people with disabilities, older people, and so forth.
What are the incentives for developers to build affordable housing? If not them, who?
Yeah, I think that's more or less the same answer. So the incentives really come from government in terms of money, and one of the tools that can be used is something called inclusionary zoning. And inclusionary zoning is essentially a requirement that a developer has to build a certain proportion of units in a new build that are below a certain market threshold. So often they'll say, you have to do X percent of units that are 80% of market rent or more, or less, in terms of more affordable. And so, and in exchange, they'll usually get more height for that, right? So, if the local regulation is that 20 stories is the max, they'll trade, we get extra 5 stories, and in exchange, you have to build them, a certain number of units to this 80% of market affordability. So that's the way the private sector does it. But on the non-market sector, that's really the best way for us to do this, is to grow that non-market sector to the greatest extent that we have, and build more capacity there.
Okay, someone wrote, thinking about the level of public support needed to push this agenda onto the radar. If there will be 1 million plus 80 plus seniors in 2041 in the GTA, there are currently about 2 million plus 30 or 40 somethings that will be on the hook for the care of these individuals. What efforts are being made to reach out to these younger people about this impending boom of care need?
Yeah, I think that's a really good question. I think at the moment, people are just kind of grappling with trying to understand what generally are people's plans. And, I've seen some polling about this. And for the most part, people are saying, yep, I plan to stay in the house that I've lived in for most of my adult life, as long as humanly possible. And then there's the expectation that they're going to receive supports if they need them. I mean, the truth is that most people don't think that far in advance, and kind of go day by day, and things change with respect to their functionality at really small increments, right? So they just change very, very slowly, and people don't really kind of notice. So for the most part, I would say there's not been much focus on young people. I think that actually we do need to reach those people who are kind of my age and a little bit older, to begin to think like, okay, what are you going to do in 20 years? I'm in my mid 50s, and there's generally it's thought that the optimal time to make some kind of move is in your 70s, and that's in terms of thinking about how you're going to plan these things out in the future. I went through this actually with my own parents about 4 years ago. They moved into a new house from the house that I grew up in, and I went looking with them for a new house, and they were mostly looking at more car dependent stuff. And at one point, my father got annoyed with my reaction to some of these things and said, I know you want us to live in an apartment, but we're just not ready for that. I said, okay, well, that's fair. That's definitely what I was implying. So, I understand that you don't want to do that. I'm not going to push you any harder, but I would like you to think about this. Where are you going to live when you can't drive anymore? And that was it. That was, for my father, was like, okay, that made sense. So luckily they ended up in a single floor house. They'd previously been in a 4-level side split, which, was really challenging, particularly as my mother had some mobility issues. And so now they live in a single floor house, and it's 4 blocks from a strip mall with a grocery store and a pharmacy and a bank. And so, 15-minute neighborhood right there, and 2 blocks from the bus stop that takes them to the Meadowlands in Ancaster for a wider set of services. And so anyways, my father's even been taking the bus on some of his trips when he goes downtown for some of his things. So it's been a very good outcome. But the thing is, that's a great story. We have to multiply it by a couple 100,000.
Yes, absolutely. One of our viewers writes, thanks for the great thought-provoking talk, Professor Dunn. Does your proposed model include recommendations with regard to the types of appropriate housing tenure, i.e. legally enforceable property rights that articulate due process rights that seniors should have with regards to their housing?
Yeah, absolutely. So, people do, certainly owners have very strong rights in that respect. But one of the things in terms of legally enforceable rights, and thanks for that, Craig, I recognized, I know your background, so I know where that's coming from. But one of the things that we've been really relatively weak on in Canada are rights for renters. And so tenants' rights are actually very weak in Canada compared to other countries. And so I think in that respect, they definitely bolstering, and that actually might make people more comfortable who previously had been owners, maybe becoming renters later in life, because then if they had more security of tenure, which is the term we use for the tenures, the term that we use for the kind of legal entitlement that people have to use the property that they're living in. So people can be in the renting tenure or in the ownership tenure. And so we have poor protection for renters. And so that form of tenure tends to be less stable. So I definitely think that's an issue. But by no means, is the government going to start seizing people's property or anything like that. I think property rights are going to remain very strong, particularly for owners.
Okay, great. Thank you. Experience has shown us that specialized environments that accommodate people with varying but more intensive needs can create barriers for balanced, diverse, and multi-generational living. What thinking has been done on how to balance the possible life experience?
Yeah, I mean, to be honest with you, the idea that I like the most is trying to overcome some of the challenges that have been created by segregation of different housing forms. So urban planning has, a 100 and almost 200-year history. And in the early stages, it started with, let's separate the residential land uses from the industrial land uses, because industries were really, dirty and polluting and unpleasant and so forth. But that became more refined into the 20th century so that we actually separated different kinds of housing. So we said, okay, this is going to be the area where the apartments are. This is going to be the area where the single family dwellings are. This is going to be the area where the townhouses are. And it became that much more finer. And the problem that we've run into with that is that we now don't have we have very few areas where people can live in the same area throughout their life cycle and have a type of housing that's appropriate to their needs, right? So in order to get into some areas, the entry level is a 4-bedroom house. And so it means that it's very hard for a young family to get in there, and they might have to climb the property ladder a couple of times, right? Starter home, condo, starter house, and then get into something that's more family appropriate. And at the same time, on the other end of the life course, we have people who want to stay. Part of the reason they want to stay in the home that they've been in, even if it's a single detached dwelling that might not suit their needs as long, is because they've got the social connections and the comfort in their area. Well, what if they could move to a place that was more appropriate to their functioning, but it was in the exact same neighborhood, so they could maintain their daily patterns and their volunteer activities and their recreational activities and their social relationships and so forth. So increasingly we should be thinking about that, and but that requires more infill kinds of development, right? So replacing existing single family houses with multi-unit, and that runs into all kinds of problems around NIMBY, not in my backyard, because there's a lot of opposition to those sorts of things. And so that's a whole set of other problems.
Someone is asking, how many people need to live together in order to warrant services being available on a daily basis? So I think you touched on this in your presentation. So just wondering, yeah, how many people need to live together to warrant these services?
I don't think there's any particular number. I think the idea is that, even if we're talking about a situation where you've got home care workers who are traveling around from dwelling to dwelling, if they have shorter distances to travel, then that's going to make things more efficient, right? And so that might be, different dwellings, different apartment buildings in the same neighborhood versus, the 5 visits a day model. Like when I heard that the average home care worker makes 5 visits a day, I thought, oh my gosh, that's a really small number. And they're spending most of their time actually in transit between places. And so, there's really, it's about thinking about how can we create our built environment so that those kinds of supports can be delivered in a more efficient sort of way. So I don't think there's any kind of magic number or optimal number. The Stillbrook organization has come up with this particular number of 162 units and 190 people based on their calculations that, include things like they get affordable housing construction money from the federal government, and they're able to, they're able to deliver 30% of units at $2,000 a month, and that includes all meals, all supports, all services, including the home care services, and then a higher price point for people who might have a little bit more, like private pension income and so forth, at about $2,700 a month, and that's significantly cheaper than what the for-profit private sector is providing. So, but they've penciled it out on that basis, and they are very lean on land as well. So their buildings take 1.1 acres of land, so they can go in a lot of different places. But it's really, I think it's not so much about there being one specific guideline. It's about enabling different organizations, creating more capacity in organizations like Stillbrook to come up with new innovative approaches. And another one that people may have heard of is called co-housing, which has both shared spaces and private spaces. That's really hard to do because zoning doesn't really permit it very well. And so anyways, those lots of different innovations, and we just have to really be in a position where you can encourage as much of this to happen as possible.
Yeah, that's great. Somewhat related, on that note, how can we encourage government to support nonprofit housing assisted living? Presently, the priority is for nonprofit services in healthcare and long-term care.
Yeah, well, I mean, I think that's what a number of programs in the National Housing Strategy are trying to do. So it's basically affordable housing construction, and there's requirements in some of these programs for 30% of units to be offered at a certain level of affordability. And again, there's a lot of work going on to try and build capacity in these not-for-profit, non-market kinds of organizations. The challenge is it's just it's difficult work to do. It's hard to launch these organizations in the first place, and we just really need more and more of that. I mean, one of the very innovative things that's happened recently that hopefully will allow us to scale a bit more is there's an organization in Hamilton called Indwell that is quite celebrated for their great work in doing supported housing for people with mental health and other kinds of needs. And they have now spun off a new not-for-profit organization that will do nonprofit development for other organizations. So they had their own kind of development shop, and they basically said, okay, we're going to try and expand our development capacity of affordable housing that we will lend on a cost recovery basis to other organizations who want to do other kinds of mission related sorts of things.
That's great. Thank you. There's two questions here. They're somewhat related, so I'm going to try to combine them here. So one viewer notes, I'm in my 80s and have found enough help by renting at a lower rent in exchange for help domestically. When matched carefully, this could work well. The second question, somewhat related, one of our viewers says, how about the Golden Girls model? There's one in Port Perry that works really well. So could you comment on that, the cohabitation between various groups or various people? Could that be a solution, or at least part of a solution?
Yes. Well, I think the point about it has to be very carefully done is exactly right. So that sounds like a great situation that you're in, and that sounds actually really terrific. And I think that the challenge is, can we create organizations and institutions that can protect people in those kinds of situations? Because I worry about, the potential for people to be exploited or and those sorts of things, right? So it's really a significant concern from my standpoint. The Golden Girls model, has a lot, for lack of a better term, yes, I get the appeal of that. And so to me, the appeal is that it's informal supports. What worries me about that, and I think I actually met some of the people from Port Perry because I gave a talk in Peterborough about 4 years ago, and there was a woman in the audience who said, I'm about to move into this house. And it was, what she described was essentially the Golden Girls model. What I worry about is that it's a dependency on those informal supports. So those informal supports can work well when people's needs are modest, right? But if somebody, rapidly deteriorates in terms of their functioning, and then there aren't family supports to take to get to come in place and so forth, it could leave a pretty awkward situation where you've got one of the roommates, for example, who suddenly has a lot of needs, and it's and the other roommates are in a situation where they're providing a lot more support than they bargained for, and how do they get out of it, right? And so that's not to say that they're being unkind or anything like that. It's just different than the implicit social contract that they got into in the start of that. So I don't know. I mean, it may well be undoubtedly there's smart people doing these things, so they may have thought of these kinds of things, but that would be my immediate worry for that.
That's great, thanks. And lots of comments in the chat from people that work with Indwell, and said, thank you for your information today. It's been incredible. So given the time, I've got one last question here. Someone is asking how we can be a part of your upcoming research.
Oh, yes. Well, there is a possibility for that. And I'm trying to think what the best way is.
We do a follow-up email. Someone else was asking, they're trying to take notes and want to get names of things. So this session was recorded, and anyone who has registered for the talk will get a link to the recording. So you'll get those resources that Dr. Dunn was talking about, but in the email that I send that out in, I can also include some information and resources based on this last question.
I'm giving you the other organization that I mentioned, Stillbrook Affordable Retirement Residences. They're in early stages. They have about 10 sites around the province that they're still working through planning approvals on, but they're quite innovative. So,
oh, that's great. I can definitely share that information. So I will get that upcoming that information from Dr. Dunn and share it with all of our registered guests as well. So just want to say thank you so much for joining us this evening, for taking time out of your busy schedule to speak to our group. For our viewers following the webinar, you'll receive an email link to a survey. If you can kindly take a minute to fill that out, we appreciate all the feedback. For more information on all upcoming alumni events, please visit our website at alumni.mcmaster.ca /events. And as I mentioned, I will also be sending out an email likely later this week or early next with a link to the recording and any information that we said we would include it. So Dr. Dunn, thank you so much again for joining us this evening. And to all our viewers, thank you for tuning in, and we hope you have a great evening.
Thanks, folks. Take care. Good night, everyone.